Good day, everyone. We are going to report Streptococcus pyogenes. Physiological characteristic. Streptococcus pyogenes, or also known as Group A Streptococcus, is a bacteria that grows in chain and causes numerous infections in humans. These diseases include strep throat or acute pharyngitis and skin and soft tissue infection such as necrotizing fasciitis or flesh-eating disease and toxic shock syndrome. Streptococcus pyogenes characteristically is a round to ovoid in shape and is 0.6 to 1 micrometers in diameter.
These are the spectrum of diseases of Streptococcus pyogenes. First, we have pyogenic, meaning it produces pus or nana. So we have here impetigo. It is a contagious skin infection that causes an accumulation of honey-colored crust on top of the skin. It only affects the superficial layer of the skin. Next, we have erysipelas. It is a skin infection that also affects the topmost layer of the skin. It results in a fiery red rash with raised edges that can easily be distinguished from the skin around it. Next, we have cellulitis. It is a bacterial infection of the skin and tissues beneath the skin. It causes redness, pain and tenderness, swelling, enlarged lymph nodes, and warmth on the affected area. And lastly, for diseases that produce pus, we have pharyngitis. It is an infection or irritation of the pharynx or tonsils. It is usually infectious, with most cases being of viral origin and most bacterial cases attributable to group A streptococci or gas. So next we have toxigenic, meaning producing toxins or it has a toxic effect to the body. So first we have toxic shock syndrome. It is a rare but serious medical condition caused by bacterial infection. It results from bacterium getting into the bloodstream and producing toxins. Sometimes it is associated with tampon use. Next we have gangrene. It is an acute, rapidly progressive, severe, deep-seated infection of the subcutaneous tissue. It is associated with extensive destruction of superficial and deep fascia. It may arise from minor trauma or spread of group A streptococci from the throat to the site of blunt trauma or muscle strain. Then we have scarlet fever. It is an illness that develops in some cases of strep throat. Its symptoms include sore throat, fever, and rash. It is when the bacteria releases a toxin that produces the rash and red tongue. The infection spreads from person to person via droplets expelled from an infected person. And lastly, we have immunogenic, meaning it provokes an immune response. We have here rheumatic fever. It is a disease that affects the heart, joints, brain, and skin. It develops from strep throat and scarlet fever infections that were not treated properly. Prevention of recurrent episodes and the development of potential serious outcomes of rheumatic heart disease require secondary prophylaxis of penicillin.
These are some ways to prevent strep infection. Proper hand washing. It is important to wash your hands regularly with soap and water because it is one of the best ways to prevent all kinds of infection. The bacteria that cause strep throat tend to hang out in the nose and throat, so sneezing, coughing, or shaking hands can easily spread the strep infection from one person to another. That is why it is so important to wash your hands as often as possible. If soap and water is not available, we may use alcohol-based hand sanitizer. Cover your mouth when coughing or sneezing in order to avoid spreading infection across the room, which could also cause others to get sick since nasal discharges are the most dangerous source for spread of these organisms. Avoid sharing personal items because this bacteria can be transmitted through direct or indirect contact, such as sharing utensils and drinking cups. Consult your doctor. If you suspect you have strep throat, it is advisable to have an appointment with your doctor to get the prescribed medication you need to prevent serious side effects of strep infection.
Therapy or treatment of Streptococcus pyogenes. Penicillin or amoxicillin is commonly recommended antibiotics because of its narrow spectrum of activity, few adverse effects, and a modest cost. Patients without penicillin allergy. Example for this is penicillin V oral for children with 250 mg for 10 days, and amoxicillin oral for adults with maximum of 1000 mg also for 10 days. But there are alternative antibiotics for those patients with penicillin allergy, include a first-generation cephalosporin, clindamycin, clarithromycin or bryaxin, or azithromycin. In addition, patients are placed on continuous prophylactic antibiotics to prevent repeat strep throat infection that could potentially lead to repeat a case of rheumatic fever.
Generally, prior of initiation to treatment, you need to assess if the patient had history of drug allergy. Drug allergy may cause anaphylactic reactions that may endanger the patient. Next, proper dosage and timing of taking antibiotics. Some antibiotics are given once daily, twice daily, or 3 times a day. Some antibiotics are given before meals, during meals, or after meals. Also, there are some antibiotics that may interact with food and other drug. So, you need to follow your doctor's prescription when taking antibiotics. Avoid stopping the medication abruptly. It may cause drug resistance. Drug resistance is the reduction in effectiveness of a medication. That would be all. Thank you for listening.